So I made a video showing that, saying that according to science, people that have gray hair or baldness, if they are bald, they are 5 to 6 times more likely to develop heart disease or prostate cancer. And this person asked an interesting question. He said, what if your doctor tests you and you are okay, but already having gray hair at 40? Now, the gray hair thing is actually that if you're having it before 40, that's when it's really dangerous. Okay, it's different from having it at older age, but if you're having it before 40, you should be alarmed. Like, you should start looking at the solution. I'm going to tell you some of the solution, but let's look at some of the evidence. So look at this. It says, according to American Cancer Society, the average age of diagnosis for prostate cancer is 67. So you can be 40 and feel that you're okay. If you go for test or anything, they're not going to see anything. All right, because you've not even reached the average age. Average means 50% of people that are diagnosed are above 67, 50% are below. So you might be perfectly okay at 40. All right, so the reason I made that video is to warn you that if you have gray hair, your hair is graying out, it could be a sign that there is a bigger problem inside. Your hair is warning you. Or if your hairs are falling off, it's a sign. Okay, look at this. In men, 60% of cases are diagnosed in men who are 65 or older. So most of the cases are for people above 65. The most common age of diagnosis is 70 and 74 years old. It's between 70 and 74 years old. And it's rare for men under 40 to be diagnosed. Rare. It doesn't mean that it doesn't happen, but it's rare. Okay, age is a significant risk factor for prostate cancer, and the likelihood of developing the disease increases as men get older. However, cancer can be diagnosed and so on. So you can read out. What of heart disease, heart attacks? The average age of first heart attack in the United States is 65 years old. Remember that US, their health system and everything is fine, and they keep records. Okay, it may be different from your country, but this is just for informational purposes. 65 years old for men and 72 for women, according to the data from 2005 to 2014. So you can read more. Okay. Um, However, the incidence of heart disease has increased in people under 50 years old over the past 10 to 15 years. So over the past 10, 15 years, it's getting worse. Like, people younger are starting to get it. Okay. But mainly it's for people from 65 years. So look at this. Right? It says male pattern baldness and premature graying associated with risk of early heart disease. They are saying that baldness and graying is even worse than being obese, like being overweight. Look at this. In 2007, 10, okay, male pattern baldness and premature graying associated with a more than fivefold, that's 5 times risk of heart disease. All right, before the age of 40 years, according to research presented on the 69th annual conference of the Cardiological Society. Okay, they said obesity was associated with fourfold risk of heart disease. So overweight people, they are 4 times likely to have heart disease than normal people, right? But then people that are gray or bald, they are 5 times. For baldness is even worse. Baldness is 5.6 times more likely. Okay, then gray hair is 5.3 times. Okay, so you are supposed to be careful. It's not to put fear in you, but it's supposed to warn you that 60s, 70s, there may be a problem by that time. So you start taking care of it now to make sure that you don't end up in that problem. Look at this study. Okay, they were studying the degree of hair graying as an independent risk marker for coronary artery disease. Okay, so you can read that. You can Google this topic to find this study. But when you come to the conclusion, it says higher hair white score, this is higher gray hair, was associated with increased coronary artery calcification and risk of coronary artery disease independent of chronological age and other established cardiovascular risk factors. Just by having more gray hair, you have a higher risk of coronary artery disease. The key thing to note is that it's before the age of 40. Developing baldness and graying before the age of 40. Some people are boasting that they have been having gray hair since they were 15 years old, since they were 9 years old. This is what they are talking about. That is not safe if you developed it before 40. That there's something that is. Another thing is people already have cancer. They can even develop gray hair. Cancer can cause gray hair, okay, in some cases. So you can read it more. But gray hair does not cause cancer. It's just that they go hand in hand. In some cases, not all cases. I don't know if you're getting me. It does not cause cancer, okay? Because gray hair means that the melanocytes, the cells that produce hair color, are susceptible to DNA damage, okay, are no longer present in hair follicles. As people age, melanocytes die off, especially from around age 30. You can read more. Your melanocytes die off, right? So if you're bald and you're graying, that's two bad combinations. It doesn't mean you're going to fall sick as you age. Of course, many people are able to get through to 90-100 with the combination and nothing happens, right? But they just say that the chances of running into these two diseases, prostate cancer, coronary artery disease, heart disease, is high. So what it means is that you should be running tests often, since now you know the test to run, all right? I usually advise people to give themselves that New Year gift at the beginning of every New Year. You go and run this test just to be sure. If they find something, it will help you to find it early, so you can tackle it. Most diseases are treatable if you find it early. So if you find out that your prostate is getting enlarged, you can treat it early. You are having coronary artery disease, there is always an early treatment that works. Okay. So once you meet your doctor, they will guide you properly. If you don't like the doctor thing, you want to try herbs, chat me up. We have herbs that treat many of these things. So I'll give you the list of the herbs. You go and you show it with consult your doctor with it. Then your doctor will approve it or not. Okay. So, but we always have herbs for some of this. If we don't have the herb, I'll tell you that we don't have that one. Now, if you are losing hair, I've already created an oil that regrew my hair. I used to be bald. I didn't have hair here before. At the beginning of this year, I didn't have hair. My hair was like this. But now I've regrown my hair to this point. Okay. So if you want to regrow your hair, chat me up. If your hair is graying out, chat me up. We have oil that you apply that will help to regenerate. But remember that it's just a symptom. The problem is from inside your body. Most likely loss of nutrients. Maybe loss of a number of nutrients. There are key nutrients that if you are losing it in your body, your hair will start graying. Some medications may trigger such loss of nutrients, and now your hair is graying just because you are treating another disease. So my hair cream is not just a list of ingredients that you need to create a hair cream. It also contains a list of supplements that you take. All right. So you take it, discuss with your doctor, then you start applying it. Okay. So it's a list of ingredients, not the oil. So once you get the list, you use it and prepare the oil by yourself at home. It's not free. If you need it, chat me up. Okay. Just send me a message and make sure you follow me. Look at this plus sign if you're not following me, and look at the comment section. Drop a comment. I read all comments. So, unlike our forefathers that used to didn't have much information, now we have much information. All right. Some people will say that their father had gray hair from the womb and lived up to 90. Your father did not eat junk food. Your grandfather did not eat junk food that you're eating now. The junk food we're eating now has made us weak. In fact, do you know that everything that enters your mouth is actually junk food? We no longer have natural food again. They have done GMO on fruits. The fruits are now genetically modified fruits. So it's no longer natural fruit. Not to talk of when you're not eating processed sugar, processed this. And we now have diseases that we didn't used to have. In Africa, we didn't used to hear about diabetes and high blood pressure. We now have all those things. So you're not in the same condition as your forefather. Your grandfather, did they breathe fumes? This CO, carbon monoxide that we breathe from cars in the name of driving in traffic. They didn't breathe it. So at the end of the day, life is different now.